I would come into the patient's room and introduce myself. I'm CJ Lorez. I'm a student nurse here at the College of Nursing, and I'm going to be inserting an IV today. I would check the orders to see that I have to insert a saline lock in the morning for a CT scan. I would check the hospital policy. I would gather my equipment and perform hand hygiene. I identify the patient using two identifiers: the name, which is Jones Jaguar J, the medical record number 4176352. 4176352. I would identify the patient's allergies, penicillin, and I see penicillin. I would I would ask the patient about any allergies, explain the procedure, and I would maintain privacy of the patient. I would position my trash can, perform hand hygiene, and I would don my goggles. I would position the bed to a comfortable working position, lower the side rail, and I would position the patient supine or sitting. And then I will begin opening my packages. I have a sharps container for the sharps, and I will open my packages, continuing to maintain privacy of the patient. I would open the Tegaderm. I don't have a Tegaderm anymore because I use them all, but I would open the package and leave the Tegaderm sitting. I would open the over-the-needle catheter. The saline. And I will have 2 pieces of tape. And I have a waterproof barrier that I will place underneath the patient's arm. I would then swab the injection cap. And I will loosen the cap of the extension, and I will connect the saline. And prime the tubing. I will open the core prep, remove the over-the-needle catheter. If I had a Tegaderm, I would remove the Tegaderm package. But today I'm just going to use tape and cover the IV with tape. But normally in a hospital setting, we would have Tegaderm, and I would apply the Tegaderm. So next, I will select a vein. When selecting a vein, you want to use the non-dominant arm. You want to select the most distal site, and you want to use a large, soft, spongy vein. And then to foster a vein, you can apply warmth. You could stroke the vein lightly, or you could, if the patient was able, you would ask the patient to open a fist and make a fist. So now I will apply the tourniquet. You want to apply the tourniquet 4 to 6 inches above your insertion site. Once I apply the tourniquet, I would check the radial pulse. I would apply clean gloves. I'll move the saline lock nearby the bed, maintaining sterility. Next, I would cleanse the site with core prep, and I would cleanse the site vertically and horizontally and in a circular motion. Next, I will perform the puncture. I would ask the patient to remain still. I would instruct the patient that there would be a quick stick, and I would insert the needle at a 10 to 30 degree angle. I will anchor the skin about 1.5 to 2 inches below the insertion site, still not touching the where the area I just cleansed. I would make sure I do not touch the catheter to my glove. So I will anchor 1/2 to 2 inches below and insert at a 10 to 30 degree angle. Once I observe for blood return, I would advance another 1/4 inch. Next, I would hold the skin tightly and I would advance the catheter all the way to the hub without advancing the needle. And then I would release the tourniquet. Once the tourniquet is released, I would hold the skin tightly about 1 1/4 inch above the insertion site, and I would remove the needle. And then while I would stick the needle into my sharps container, and I would quickly insert the saline lock. I would aspirate for blood return, and once blood return was noted, first I would secure with tape. Once secured with tape, I would aspirate for blood return and then flush the catheter. I would remove the saline and I would secure with tape. Normally you would secure this with Tegaderm, and whenever you secure with Tegaderm, you would only touch the edges. You would not touch the sticky part that was going on to the insertion site, and you would only cover up to the hub. You would not cover the connection or anything. So I'm just going to simulate with tape. Once that was secured, you would clean up your equipment, remove your gloves. You would then apply a label to the Tegaderm. You would apply with the date, time, and the gauge needle, and then you would teach the patient of signs and symptoms of filtration, infiltration, phlebitis. You would want the patient to observe for if there was any blood coming out around the needle. You would want them to keep the IV covered whenever showering, and you would ask them to not use this arm as much as possible. You would lower the bed, raise the side rail, position the patient for comfort, make sure the patient had all the necessities, make sure the patient had the call light. You would secure the tubing with a new piece of tape. You would do this before you took off your gloves and everything, but you would want the tubing to assume a natural position. You would do this after you apply the Tegaderm, and then you would just secure with tape. Once that was secure with tape, then you would go through the other motions. Once you taught the patient, positioned the patient, cleaned up your supplies, performed hand hygiene, you would go back to the nurse's station. You would document the date, time, how the patient tolerated the procedure, the location, the number of attempts it took you to stick the patient. You would know if there was a presence of a saline lock. You would know if there was the method of infusion, the flow rate of infusion, and you would note how the patient tolerated the procedure. Later, whenever it was time to remove the IV, you would come back into the patient's room, explain that to the patient what was going to happen. You would perform hand hygiene. You would don your goggles and clean gloves. And for this, I would need another piece of tape. And some 2x2 gauze. The waterproof barrier would be underneath the patient, and then apply clean gloves. You would remove the Tegaderm, pulling towards the insertion site. You would place the 2x2 gauze over the catheter. You would remove the tape on the tubing. When removing the catheter, you want to remove the catheter parallel to the skin. And before putting the catheter into the sharps container, you would assess the intactness of the catheter tip. You would dispose of it into the sharps container, and you would want to hold the gauze onto the site for at least 30 seconds. If the patient was on the anticoagulants, you would need to hold the gauze for 5 to 10 minutes. You would then secure the gauze with a piece of tape. You would remove your gloves, perform hand hygiene, lower the patient's bed, and make sure the patient was in a comfortable position, make sure the call light was in reach, and then you would go back to the nurse's station and you would document.